Hello, good morning. My name is Jacob Mather, one of the Trauma Intensive Care Fellows at Salford Hospital. I've completed my internship in the UK, completed it last summer, so I have quite a good idea of what the process is of applying, of kind of going through it, and I've been involved with the MedPrep as well, so I'm starting to become a bit more familiar with the application process for you guys. There are a couple of names that I recognise from Malaysia and from the UAE, so thank you very much for coming back. And we'll go through the short presentation. If there's any questions whatsoever, please just put them in the chat and we'll go through them at the end. We'll make sure we try and answer as much as we can. So, things that we're going to try and cover today. We'll give an introduction to the foundation programme and the UK Foundation Programme Office, or UKFPO, which is the application portal, which is essentially the internship programme for the UK. We'll touch briefly on eligibility and the application process for international doctors. And we'll talk about some of the key changes because it's actually changed quite drastically in the past 6 to 12 months. We'll also talk a little bit about what life is like doing your internship in the UK, and then we'll have a brief touch on where that can lead you with kind of processes down the line in terms of specialties and the rest of your training in the UK or abroad. So as we've mentioned, the foundation training is a doctor's internship in the UK. It's 2 years long, and throughout that time you'll be based entirely in either the hospital or in the community in a general practice or a family medicine centre. It's always supervised, you are always working, it's always paid, and you'll rotate through various specialties. The idea generally being that you will do some medicine, some surgery, some emergency medicine, some general practice, and some specialties. And there is an element of preference and choice in terms of where you want to work and what you want to work in. So I chose my jobs and I ended up doing a job that had anaesthetics in, I had emergency medicine, I had general medicine, I had general surgery, and I had general practice, because those were the things that I wanted to gain from my foundation programme and internship. In order to apply for specialty training in the UK, you need to have completed an internship. That doesn't always have to be the UK's internship, and we'll touch on that in a second. But the UK Foundation Programme is ideally set up to give you the skills and the knowledge to allow you to apply for specialty training and thrive in specialty training in the UK. So, as I said, the UK Foundation Programme is an internship for the UK. However, some people will have done an internship abroad, and actually this might mean that they don't need to do the foundation programme. So if you're already in an internship programme, we've already done one, these criteria listed here essentially say that you don't need to apply to the foundation programme. So it's if you've done your internship within 1 year of graduating, it's a minimum of 12-month programme, and it's an approved training post from the GMC. And you have to have had in the clinical experience box a broad array of experience. So if it's less than 18 medicine and 3 months of surgery, if it's more than 18 months, 6 months of medicine and 6 months of surgery. If you meet those criteria, you could theoretically apply direct to specialty training in the UK. But if not, then you would need to either do an approved internship elsewhere or join the UK Foundation Programme. And that's what we're going to talk a little bit about today. So, to join the UK Foundation Programme, you need to have a medical degree that's approved by the General Medical Council, which is the regulatory body in the UK. You need to have provisional registration with the GMC, which we can talk a little bit about in a second about how you go about that. You need to have approval from your dean at your medical school about moving to the UK and working there, which is essentially a reference. And you need to have proof of English language proficiency, which again, we can touch on a little bit about. The eligibility application is an online form. You submit your evidence with this, and it's all completed via Oriel. Now, Oriel is the online portal for which all of the UK Foundation Programme application, eligibility application, and job allocation is done through, and job selection is done through. So Oriel is where everything is. It's a single website, it's one login, and from there you'll put all of your data, all of your details, and you'll get all of your job offers and job applications back through there. It's a reasonably straightforward piece of software. It's basically put your details in, tick all the boxes, they will sort the rest. You'll be able to get your jobs out at the end. Now, there have been some big changes to the UK Foundation Programme application in the past 6 to 12 months. Crucially, international graduates can apply directly to the UK Foundation Programme once they meet those eligibility criteria, which we've just mentioned. Previously, when I applied for Foundation Programme only 2 years ago, people were ranked based on their performance at medical school, so their educational performance measure, and on an exam called the Situational Judgment Test. Those processes no longer apply. And currently in the UK, the system is essentially done on an algorithm that allocates people based on their applications and preferences. There is no criteria you can use to bump yourself up the list or down the list. The idea is that it's now done based purely to give more people their higher choice of jobs. The UK graduates will soon have to complete the UK MLA, and this may come into role in terms of applications for the UK Foundation Programme, but at the moment it doesn't for them. However, for you guys, you will have to have completed this. And for the UK MLA to book the exam, there's a waiting list of up to about 6 months for part 1. However, if you're applying for the Foundation Programme, you can highlight this and you'll get a priority list and priority seating from the General Medical Council, which essentially means that you will get to sit the exam sooner in order to meet the time constraints for the UK Foundation Programme. As we've mentioned, there's a new kind of a web format, so Oriel is where all of your applications are, and the GMC and the UKFPO websites where all of the guidance is found. Everything you'll need to find out will be on there. So on this is quite a busy look at some key dates that you will need for applying for the UK Foundation Programme. So just looking roughly at the months, in July, the application to prove your eligibility opens, and it's done all through Oriel, who will then release the outcomes to you in August. September, you need to confirm that you've booked onto your part 1 of your UK MLA, your applied knowledge test, and prove that you're due to sit that. In October, it's a deadline to qualify from medical school for applicants who require UK MLA. November is the last possible examination date for the AKT. And actually, as we've mentioned, the GMC will prioritise you and make sure you try and get you in before this if you give them enough notice. Once the results come out, you need to submit these to the UK Foundation Programme in December. Then in January, you need to request your practical exam or your OSCE, the CPSA, and about booking that. And then you need to send your booking confirmation in February. By April, you need to have applied for provisional registration with the GMC. And in May is the deadline for passing the second part of the UK MLA, the practical exam. You need to send those results to the UK Foundation Programme in July. And in August, the first Wednesday of August, the Foundation Programme will start. Again, that's quite a busy slide. There's a lot of information there. If there's any questions, please put them in the chat and we'll come on to those shortly. The Foundation Doctor, as we've mentioned, it's a 2-year programme. You will do 6 rotations, so 6 lots of 4 months. As a general rule, this will involve 1 medical job, 1 surgical job, 1 emergency medicine job, 1 general practice job, and then some involvement with specialties, be that paediatrics, be that psychiatry, be that anaesthetics, be that intensive care. You are fully supervised throughout. You're a junior member of the team with senior support from consultants and senior doctors. And as a rough guide, the pay starts at around 30,000 per year, but it actually usually now starts slightly higher than this. You will rotate through these different specialties, doing different kind of jobs and tasks. But in terms of things that you'll actually be doing on a day-to-day basis, typically mornings will involve ward rounds, reviewing patients, discussing patients. Throughout the day, you will do the jobs that need to be done, be that seeing your patients, examining your patients, booking their tests, doing their blood tests, ordering their scans, prescribing their treatment, and also responding to emergencies. In the afternoon, There's often time for some sort of academic development, so be that attending clinics, assisting in procedures, engaging with other healthcare professionals and other specialties, and completing the tasks set out from ward round. And on-call shifts are when you'll typically work nights or weekends. These are not done in every specialty, but are needed in some of them. And your role here is to manage urgent patient needs and emergencies with the senior support of your colleagues as well. It's a really good opportunity to develop those skills and develop those important emergency medicine skills in a supportive environment where you have senior colleagues around for help, support and assistance. Just briefly to touch on the specialty programme in the UK and ongoing training. So top left of your picture, medical school, which you're all kind of a part of now. The foundation years, it's a 2-year programme, which is your internship in the UK. Once that's completed, there's lots of things you can do. If you want to stay in the UK, you can apply to GP training, which is 3 years and work as a full-time GP, fully qualified GP, and develop your specialist interest from there. You can apply to specialty training, be that medicine, be that surgery, be that anaesthetics, be that paediatrics. Training varies, often between 5 and 8 years, after which point you can get your consultant post, or you can enter non-training posts where you increase your skills, knowledge and experience in the particular area, such as what I'm doing now with fellowship years, in order to develop your CV and develop yourself before you apply to specialist training jobs. There are a vast array of specialties in the UK. This is a very, very small subsection of them. All of these can be applied from after sitting the UK Foundation Programme internship. The idea of this is it gives you, the foundation programme gives you a broad base of knowledge to allow you to have the skills and knowledge to apply to any of these specialties. Just looking at medicine in particular, all of these subspecialties can be applied through general medicine after completing the foundation programme. So it really is there to open your opportunities up and to allow you to develop and train in the areas of interest that you have, and there are no limitations after completing your foundation programme. Thank you very much for taking the time to listen to us. I know there's a couple of messages in the chat, so we'll try our best to answer them, and if you've got any more, please pop them in the chat and we'll take it from there. Thank you very much.